This conference will now be recorded.
TSCA is a regional partnership group of the National Council on the Environment. TSCA aims to advance effective action to address growing concerns about the links between human health and environmental factors. You can find more information on the following websites: acaction.org and healthandenvironment.org. You can find links to the websites of the organizations represented on this call, as well as other background materials by clicking on the title of today's call on the homepage of our website. Again, that address is www.acaction.org. The call will last 1 hour, and except for the speakers, all participants are muted during the presentation. Today, our presenters will share their expertise and perspectives on the Safe Chemicals Act, a bill that would update U.S. chemicals policy for the first time in more than 3 decades. And I would like to invite Richard now. I'm going to go ahead and introduce you, but you can unmute your line so you're ready. Star 2. Now it is my pleasure to welcome and introduce our first speaker, Dr. Richard Denison. Richard is a senior scientist at Environmental Defense Fund. He has more than 25 years of experience in the environmental arena, specializing in policy, hazard and risk assessment and management of industrial chemicals and nanomaterials. He is a member of the National Academy of Sciences Board on Environmental Studies and Toxicology and its Standing Committee on Emerging Science for Environmental Health Decisions. Richard serves on the Green Ribbon Science Panel for California's Green Chemistry Initiative. Welcome, Richard. Would you like to go ahead and begin?
Yes, thank you, Diana, and thanks all of you for joining the call. I'm going to speak for 10 or 15 minutes here about the Toxic Substances Control Act, a little bit about its history, and a little bit about the science that has emerged since it was first passed in 1976. We're looking at a law that is now 36 years old, has never been substantially amended, and yet in those intervening decades, our understanding of how chemicals can interact with our biology and affect our health has dramatically changed and improved. So we have a law that has not kept up with the emerging science. A regulatory agency, in particular the Environmental Protection Agency, with wholly inadequate authority and tools to be able to address the kinds of concerns that are increasingly evident from chemical exposures. Back when TSCA was passed in 1976, I think there was a feeling that the primary way in which people would be exposed to chemicals would be by living near facilities that were producing or handling those chemicals through air emissions, through water discharges, through waste disposal practices. One of the things that we have learned in the intervening decades is that while we have been somewhat successful in reducing exposures through those routes, in fact, the great majority of a chemical that is produced ends up in products that we encounter and materials that we encounter every day. If you look around the room that you're in, virtually every item in that room, the carpeting, the paint on the walls, the furniture, as well as more consumable products that we use every day, contain chemicals and contain a growing diversity of chemicals. And what we are learning through science over the last couple of decades is beginning to connect the dots in regard to the exposure of to those chemicals and the effects that those exposures have on our health. So I want to just briefly touch on 3 of the dots, if you will, that are being increasingly connected by emerging science. The first finding is that there are certain chronic diseases in the human population, especially in developed countries, that are rising in incidence despite an overall improvement in health. Several chronic diseases of a very serious nature are increasing in incidence. These include conditions and diseases such as learning disabilities, which Maureen will have more to say about, autism, especially in the young, Alzheimer's and Parkinson's disease in the elderly, a growing loss of fertility or other problems related to reproductive health, increases in asthma, increases in certain cancers, in particular childhood cancers, brain tumors, and leukemias in particular. That is just a small list of the types of diseases that are increasingly being linked by scientific studies to chemical exposures. Most of the evidence that we have is emerging from studies that are conducted in laboratory animals, but increasingly those findings in laboratory animals are being confirmed in the human population through epidemiological evidence that's accumulating as well. And I'm sure many of the people on this call know quite a bit about this increasing body of literature, so I'm not going to go into a lot of detail about it. But I think what is becoming increasingly apparent is that many chemicals act on our biology in ways that we didn't appreciate 36 years ago when TSCA was passed. They interact with our biology often at very low doses by interfering with normal biological functions and processes in our bodies, and essentially creating a perturbation of those normal functions and normal processes that can lead to disease outcome. And in some cases, those perturbations do not require high doses of chemicals to exert their effect. For example, the entire field that has emerged over the last few decades of understanding that certain chemicals can act like hormones in the body, and we know that hormones naturally act at very low doses to generate a whole cascade of effects that can have profound influence on our development, especially early in life, and on the state of our health later in life. We're also learning that chemicals can alter the genetic programming of our bodies and our cells in ways that do not necessarily require direct genetic mutation of our DNA. 36 years ago, we certainly knew that there were certain chemicals and other agents that caused direct mutations to our DNA, and some of those mutations could lead, for example, to certain types of cancers. Now we know that there is much more going on in that interaction between chemicals and other environmental agents and our DNA, and some of those interactions can alter not the sequence of the DNA itself, but the timing and level of expression of our genes that are embedded in that DNA. Some of this work falls in the field of so-called epigenetics, which is a normal process by which genes are turned on and off during development. But when that process gets perturbed by chemical exposures that either turn a gene on or off at the wrong time or alter its level of expression, that can lead to long-lasting, lifelong impacts on our health. So some of the science that has emerged in that arena is helping us to understand that low levels of exposure to chemicals and even the mixtures of chemicals can, in fact, especially if they happen early in development, for example, in the womb during a woman's pregnancy or shortly after birth, that those can have profound effects that last a lifetime. The third area of science that has emerged is the whole field of biomonitoring and our understanding that, in fact, many of the chemicals that are in everyday items that we use and encounter are getting out of those items and into our bodies. And I think 36 years ago, our ability to understand that sitting on a couch would be an exposure route to the chemical flame retardants that were in the foam underneath the upholstery of that couch would have been seen as a very far-fetched notion. Today, we now know that the flame retardants in that foam get out of that couch. They contaminate the dust that accumulates in our houses that we breathe in or otherwise ingest, and that is probably the primary route by which we're exposed to that whole class of chemicals. So those kinds of findings are also a new phenomenon. All of this science has increased the urgency for reform of the Toxic Substances Control Act, this law that was supposed to protect us from these chemicals and in fact has failed miserably to do so. And I just want to touch a little bit on some of the failings of TSCA. I would boil it down to say that there have been two primary failings. The first is that TSCA has failed to generate good information about the tens of thousands of chemicals that are on the market today or have been over the last several decades. The vast majority of those chemicals have simply entered the market with little or no testing, with little or no requirement that they be shown to be safe, and with presumptions about their safety that were based on what we now know to be rather flimsy grounds. In addition, when we do get information that indicates a chemical is of high concern, TSCA does not provide EPA with the authority that it needs to actually do something about that chemical and reduce exposure to it. The burden of proof placed on EPA is enormously high, such that EPA was not even able to ban most uses of asbestos back in the late 80s and early 90s when it tried. Its regulation that would have attempted to do that was tossed out by the courts with the argument that EPA had not met its burden of showing that asbestos presented an unreasonable risk to human health. I think most observers today believe that that standard does need to change, and that is one of the positive aspects of what we're looking at in terms of reforming the Toxic Substances Control Act. Given those failings, we have some momentum that has been building toward reform. And we have had actually some legislative progress for the first time in about 8 years of effort by many of the folks on this call and many other people. And Andy is going to talk a bit more about some of the details of what has brought that about. I want to just briefly touch on how the Safe Chemicals Act does address some of the major flaws of TSCA that I just described. And I'm going to just spend 1 minute on that and then turn it over to Maureen. Under the Safe Chemicals Act, the burden of proof, if you will, would be shifted from EPA, which is now required to prove that a chemical is harmful in order to act to control it, to industry to be able to generate the information necessary to show that its chemicals are safe as they are used. That shift in the burden is a substantial improvement. Second, information on health and environmental impacts of chemicals would be required to be developed and disclosed to the public on a much more routine basis, closing the major data gaps that apply to most chemicals currently in commerce. The industry would have immediate obligations to reduce exposures to chemicals of very high concern that were identified by those new data, including in particular chemicals that are persistent, build up in the environment, and in people's bodies and are toxic, so-called PBT chemicals. There would be much greater public access to information under the Safe Chemicals Act because the number of claims for confidential business information would be scaled back in a number of ways. Currently, companies are at liberty to claim virtually any information they submit to EPA to be confidential and not to have to even justify those claims as being legitimate trade secrets. The Safe Chemicals Act would make a number of changes in that arena that we think will lead to substantially greater levels of information available to the public and to the marketplace. Finally, the bill would put in place a safety standard for judging the safety of chemicals that explicitly requires the protection of the most vulnerable subpopulations among us. And it would require that EPA consider the aggregate of exposure to a chemical from multiple sources, rather than continue the current practice of looking at one exposure source at a time. And where possible, EPA would also be required to look at the cumulative impact of exposure to multiple chemicals that exert similar or the same kinds of health effects. So those are a few of the highlights. I will stop there and be happy to answer questions when we get to that part of the program. Thank you.
Thank you, Richard. Thanks for that great introduction to why it's imperative that our policy be updated to reflect the emerging scientific evidence on the health effects of toxic chemicals, and also for touching on the strengths and weaknesses of the bill. And as you said, there will be an opportunity at the end of the call for everyone to ask questions and to further discuss the points raised by our presenters. Now I'd like to welcome Maureen Swanson, National Coordinator of the Healthy Children Project of the Learning Disabilities Association of America. The project focuses on raising awareness of toxic chemicals linked to learning and developmental disabilities and reducing exposures to toxic chemicals. And prior to her position with LDA, Maureen was a senior policy analyst with the Minnesota Office of Environmental Assistance and an independent environmental policy consultant, working with clients in government, private corporations, and academia. And welcome, Maureen.
Thanks, Diana. Can you hear me okay?
Yes.
Great. Well, thank you, Diana, and thank you to everybody who's called in for this opportunity. As Diana mentioned, I direct an environmental health initiative for the Learning Disabilities Association of America, and we focus on chemicals that can be harmful to brain development, and then more broadly on the particular vulnerability of children and the developing fetus to harm from toxic chemical exposures. I also co-chair the health work group for the Safer Chemicals Healthy Families Coalition. And I thought I'd talk about three aspects of the health group's involvement in the campaign for safer chemicals and for the Safe Chemicals Act. And the first is that I've come to think of the health group's, one of our key roles is that we keep this issue real. We make it real for people. All of our organizations, when we talk about these issues, we of course refer to the key trends and main chemical culprits. And so I'll talk about the fact that learning and developmental disabilities are increasing, and that 1 in 6 American children is now diagnosed with a learning or developmental disability, and that the increase in the incidence is driven mainly by autism and ADHD. And I talk about the National Academy of Sciences, which estimates that environmental factors, including toxic chemicals, are causing at least 3% of learning and developmental disabilities and contributing to at least 25% of learning and developmental disabilities. So those are really important facts. But it's when a parent talks to a policymaker and says, let me tell you about my son who has autism and my concerns with the chemicals that we were exposed to when he was a baby. Or a woman says, I'm a breast cancer survivor, and I'd like to tell you about my concerns with carcinogens in our everyday products. Suddenly, the issue is real, and there's a face to it. So I think one of the key strengths that the health organizations have is that we put a face on these issues that can get abstract and start to sound a lot about numbers or a lot about scientific names of chemicals that people can't pronounce and start to seem too vague to them. In conjunction with that is that unfortunately these days everyone knows a family who is dealing with one of these serious diseases or disabilities. Everybody knows someone who has a child with autism or a learning disability. Everyone knows somebody dealing with cancer or a young couple trying to have a baby and not succeeding. And that is very much true of policymakers, of legislators and their staffers. We might not know it a lot of times, but the health organizations and health advocates often strike a chord because, again, instead of or in addition to the numbers and the facts and the science, the legislator finds him or herself thinking about their staff member whose baby was just born with a birth defect, or their neighbor who has just been diagnosed with breast cancer. So again, it makes this issue of making chemicals safer and testing chemicals for health effects, it makes it really very real for people. Along those lines, we all know that disease and disability do not discriminate according to party affiliation or political leanings, and that gives us a really strong place to speak from as well, in that the health advocates and health professionals associations tend to be absolutely nonpartisan. This is an issue that affects everybody. The need for safer chemicals certainly is common to all of us. For the Learning Disabilities Association, we have staunch Republicans who are leading the charge in some states for safer chemicals, communicating with their senators' offices. We have staunch Democrats in other states, and it truly doesn't matter. And that is true. I've found throughout the coalition, and I think one of our great strengths is that everybody has a common goal, and we really can speak to that common goal as health organizations and advocates. And that, again, is an aspect of keeping this a real issue that affects everybody and that matters to everybody. On the flip side, I think the health groups have a strong role to play in making sure that the policy reform is real, in that however the Safe Chemicals Act turns out, or whatever the legislation is called that eventually revises TSCA, it has to test chemicals for health effects, and it has to identify and remove the most toxic chemicals from commerce. And if it, after all the compromises, if it doesn't do those things, I think it will be the health groups, along with all of our colleagues in the environmental organizations and businesses, but it'll be the health groups who are saying, this needs to be real because we're talking about people's health and well-being, and we're talking about children's health. So the bill has to do what we say it will. And then to that, I'll just say that we have health voices tend to have great integrity. When the ARC of Anchorage, who's a great member of the coalition, walks into an office, they often bring with them their great reputation and integrity. Nurses, pediatricians, parents, all can speak to these issues with such integrity. And that brings me to my second key point. And in that, one reason we have that integrity is that we talk about the science around the health effects of chemicals very, very carefully. The coalition, one of the great strengths, I think, of the Safer Chemicals Healthy Families Coalition is that we have amazing scientists and doctors, Ted Shetler and Sarah Jansen and Tracy Woodruff, who are very good in helping our health organizations talk about chemicals and their effects the right way. They are quick to differentiate what we know from what we don't know about chemicals. And so I think we have built our health groups in the campaign, have in the states and at the national level, have a very good reputation because the legislative offices know that we are speaking only from the science. We're not making claims that are not that cannot be substantiated. And I'll give a plug here to the Safer Chemicals, Healthy Families Health Report, which has just been revised and is available at the website, saferchemicals.org. The health report is fully referenced and has a lot of the most recent and updated science on chemicals that are linked to certain cancers, learning and developmental disabilities, reproductive health issues, Alzheimer's and Parkinson's diseases, and asthma. And as Richard said, one reason that we're able to put that report together and to have is that we have such strong science. As Richard mentioned, the science just keeps getting stronger. And so, again, the coalition and our health organizations, one of our key roles is to make sure that policymakers and the public know about that science and know about the most recent findings. Just in the learning and developmental disabilities field, in the last couple of years, there have been some very significant studies on twins with autism that point to environmental contributors, including chemicals, playing a role in a baby developing autism. There has been a recent article by Dr. Linda Birnbaum and Dr. Phil Landrigan outlining a research strategy and naming 10 chemicals and categories of chemicals that are highly suspected of being neurotoxic. And so we have emerging science that is mounting evidence that keeps pointing to the role of toxic chemicals in disease and disability. And finally, I will talk a little bit about growing the health part of our coalition. And Pam and others have done such a great job with that in Alaska. And again, that's a place where the science and the integrity of the health voices really, really helps. That we can take the science to other health organizations who aren't on board with this yet and sometimes are just unaware of the links between toxic chemicals and certain diseases and disabilities. And so, one of the roles of our organizations within the coalition is to keep growing that health chorus of voices, both health professional organizations such as associations for doctors and nurses, and also health advocacy organizations that are increasingly including very mainstream national health voices. Again, in my field, the ARC of the United States, Autism Speaks, the Autism Society, we are increasingly have these mainstream national health organizations joining forces with us and saying, yes, we are going to advocate and push for safer chemicals and for revising TSCA to require that chemicals are tested for health effects before they can be used, and for replacing the worst chemicals with safer alternatives. And very briefly, that can I've found that can happen. Bringing new organizations into the coalition can happen in a couple different ways, and sometimes there are state or local chapters that are out ahead of things, and then they are the ones who get the attention of the national organization. I think the ARC has worked like that. We've had some great state and local chapters who then brought these issues to the attention of the national organization, which now has joined the coalition. Sometimes it's the other way around. The national organization decides to make this a priority and a focus, and then in turn, that gets disseminated to the state and local affiliates. So we work with people at both levels. At the state levels, there is so much going on with the state coalitions that is essential to the campaign, and then we're also working at the national level to get the policy folks and scientists at the national health organizations on board. So I will stop there and end with just appreciation for all the work that so many of you in Alaska are doing to bring these health concerns and the emerging science to the attention of your policymakers. It's really making a difference.
Thank you so much, Maureen. Thank you for your incredible work and for highlighting the crucial role of health organizations in supporting these protective policies. Again, hold your questions. There will be an opportunity at the end of the call. Next, I would like to welcome and introduce Andy Igrejas, National Campaign Director for Safer Chemicals, Healthy Families. Prior to working for the campaign, Andy headed the Environmental Health Program at the National Environmental Trust for 7 years, and he continued in that position when the organization merged with the Pew Charitable Trust in 2008. In that role, Andy helped put chemical policy reform on the national agenda through work on the Kids Safe Chemical Act. Andy also led NET's work on chemical security right to know, food safety, and California initiatives like the successful campaign for the Safe Cosmetics Act. And Andy will be getting in a little bit more into the nuts and bolts of the policy. So we have the science perspective, some great perspective from health groups, and now we're going to hear a little bit more about the policy. So welcome, Andy. You can go ahead and press *2.
Oh, great. Thank you. Am I unmuted successfully?
Yeah, you did.
Okay. Well, thanks, everyone. I think when we talked, it was both about the coalition, the Safe Chemicals Act, where it's at, and sort of a way forward, the strengths and weaknesses, and then what's happening with it right now. Just to step back a moment, Maureen talked a lot about the coalition, and I think particularly the health partners in the coalition, and I agree with everything that she said about that. But it's worth pointing out that I think when Safer Chemicals, Healthy Families first started, one of the explicit things we were trying to do was to create and maintain alignment among the key organizations and leaders in the environmental health movement who had been working at the national level, people like Richard, but also NRDC, Earth Justice, and others. The state level, the successful campaigns by organizations across the country that has resulted in most of the policy advancement that we've had in the country, whether it's through the coalition known as SAFER that has done that, and of course PAM and Alaska Community Action on Toxic is a valuable member of that. But then also alignment with the environmental justice community and community organizations, because there really hadn't been a lot of that. And I think that sort of founding impulse of the campaign was to have those, at least those three sort of wings of the environmental health movement, as well as the what were for us newer voices in the health community, like Maureen and other folks who were getting into the advocacy world on this, aligned, having us all aligned on what should reform of TSCA look like, what's the right mix of information reforms, right to know type reforms, updating of the scientific methods that are being used by the federal government, what's the role of state level policies and things going forward. And so that was a key goal, and I think that we have a steering committee that has leaders from each of those areas. It's got about 50 people on it from 36 organizations. And then, of course, the coalition itself has grown to being much larger. There's 440 organizations in the coalition now. It includes a lot of local businesses and green businesses, additional health partners, some from Maureen talked about, but then a lot of community organizations and particular organizations spread around the country. And I think we really have, as part of this campaign, by creating a process where more people were having a direct involvement in a national policy campaign, we've been able to enrich the discussion beyond what otherwise might have taken place. And then we've also had a greater ability to expand the map that we're working with politically, so that we now have some very good hardcore activists in Tennessee and in Arkansas, in Idaho, in Montana, in places that aren't always associated with the environmental health movement, but which actually really do reflect the underlying strength that these issues have with the American public, which is bipartisan and which is based on the sort of intimate impacts of the policy failures here, and that it really does impact, the policy failures of TSCA impact people's health in ways that everyone can understand. And so the goal of the campaign is to further that and to nurture that and to eventually win reforms that are meaningful rather than just have a win. So Richard described all of those different voices had an input into our platform, which is on our campaign site, saferchemicals.org. The platform wound up being mostly reflected in the legislation of the Safe Chemicals Act, almost every major issue. And you have things like new tools to reduce hotspots of contamination. You have a focus on PPTs. Some of the things that Richard described are in the Safe Chemicals Act because they were in our platform, because of the alignment that we were able to bring and the depth to this issue. The Safe Chemicals Act itself has passed the Senate Environment and Public Works Committee. That's the first vote on a TSCA reform proposal since TSCA passed. So even though it doesn't necessarily sound like a very big deal outside of Washington, that, well, aren't committees supposed to pass legislation all the time? Washington is so slow and so dysfunctional that it was definitely a significant milestone to get the legislation through the committee, which puts in a position where it can be voted on in the full Senate. So what we're trying to do right now is have the legislation brought to a vote in the full Senate. We've done a lot of work politically to try to make that happen. That includes getting most of the Democrats who are up for re-election to have signed on as co-sponsors, because the Democratic leadership basically doesn't want to bring forward an issue that its most vulnerable members would be afraid of. But what we've found is some of the most vulnerable people in the election, people like John Tester of Montana, it's generally considered a conservative state. We were able to do the work to have him sign on and be an enthusiastic co-sponsor because he sees the political benefits as well as actually giving a damn about this issue, which I think he really does. He sees political benefits in it. And it's that kind of attitude we want, which is people saying, hey, instead of just being afraid of the special interest money that could be poured in on the other side, we see real benefits to doing this, and therefore we would like it, Senate leadership, if you brought this for a vote. So that's sort of where we're at right now, is we're asking for that. It is, unfortunately, I'd have to describe it as unlikely because the Senate has been so bogged down by the abuse of the filibuster that they only have 8 legislative days left in this year before the election. And if Republicans were to use the procedural tools at their disposal, they could make even a simple vote on the Safe Chemicals Act, stretch it out to eat up 4 of those days. So that's the kind of thing that we're up against. It requires the Senate leadership really feeling like this is one of 2 major things that they would want to sort of showcase as their business in order for us to get that vote. But we are pushing for that, and we have a lot on our side in doing it. So that's where it is procedurally. I think it was asked specifically to describe the policy in more detail, and I think particularly since Richard described the outlines of the bill and how it would change TSCA, to describe what has changed with the bill since it was introduced. And I mentioned it got through the Senate Environment and Public Works Committee. The version that got through was changed from the version that was introduced in ways that are, in some ways, they're substantial, and in some ways that are not. but that were all done for real reasons. Maybe I'd share some of those right now. The one major activity of the campaign that was interesting is we had a delegation of people that included Richard, myself, a health representative, a colleague of Maureen's from the Association on Individual and Developmental Disabilities, named Joyce Martin. Mark Mitchell was there. He's a doctor with the National Medical Association, which is African American physicians, who's also been an EJ leader. We also have representatives from the state level campaigns and market campaigns. But we had a delegation that met in a very in-depth way with a delegation from the chemical industry last summer and fall. It was two separate 2-month processes that involved multiple 2-day meetings to go over the major issues in the legislation and see if there were ways that we could accommodate the more legitimate industry concerns. And that process was pretty fascinating. We sort of got to interact with some people in the industry at a more pragmatic level, people who were chief scientists or chief regulatory compliance officers, and you got to kind of cut through the posturing and the BS that you get from the trade associations, the PR campaigns, and actually hear some more practical concerns about what their concerns were in a changed law and if there are ways to address them. And basically the changes that were made in the Safe Chemicals Act, for the most part, came out of that dialogue. And they dealt with, I'll say, 3 major themes. The first was the biggest concern that the industry would raise was that came from their experience in Europe, or at least what they would describe as their experience with Europe. But for a lot of them, it seemed heartfelt. They had been filling out the paperwork and spending money. And their argument was that there was such a burden of developing information for so many chemicals, and then the likelihood that so little was being done with it in Europe. And they really didn't want to have to do something like that again. They wanted the information that they developed for Europe to be able to be leveraged and used in whatever reformed process we created here, so that they wouldn't have to do the same test twice, basically. And then also more broadly, they didn't want to have their biggest critique, I suppose, of the European law from their perspective, I'm not saying this is our perspective, was just that a lot of that, a big burden to develop information and then giving lots of information to this little agency in Europe, and then the agency not being equipped to use it in a meaningful way or timely way. And the argument that by the time they would get around to maybe making decisions about a particular chemical, some of that information that the industry spent a lot of time on would be out of date, et cetera, et cetera. So one of their biggest themes was, can we leverage the information from Europe, and can we have a more finely tiered and nuanced system whereby chemicals are being prioritized on rational criteria. We're requiring, there are some chemicals where maybe there's enough information that we don't need to do new testing on them. There's others, either chemicals where enough information that we know they're basically can be set aside, chemicals where there's enough information that we know they're so dangerous that the only question should really be, what are we doing about them, as opposed to having new animal tests. And then are there some chemicals that really are being used a lot? People clearly are being exposed to them. We don't have a lot of information, but there's a lot of smoke about them. And let's prioritize those for the more intensive information gathering and scientific assessment. And basically batching the workload of chemicals going through the agency, tiering the information requirements so that it's a little bit clear, well, we're requiring this amount of information for these kinds of chemicals at this point, but more for these other chemicals at that point. That whole set of things, a set of changes to what we call the architecture, was crafted in the version of the bill that passed committee. And I think that in that process, we found that actually, and there are ways of addressing those concerns that also, frankly, address some of our own goals better in TSCA reform, because there is a problem with the management of the workflow at the agency. We kind of do want them doing risk management and restrictions on the chemicals that we already know have a lot of hazard data on them and even a lot of use data. We do want the agency to kind of go straight to the action phase on those chemicals. We do want this sort of more full-blown reformed version of risk assessment that we've called for, that really reflects aggregate and cumulative and vulnerable subpopulations. We want that done well for the chemicals where it's really that people are really being exposed to. And so that's one big set of changes. That's probably most of the volume of changes. But I think from my point of view, and Richard could chime in if there are questions about this, that was a set of things that in some ways it served our goals, I think, more broadly, almost as much as industries, although we certainly don't advertise that wildly. But I think that was a good set of changes. Some of the other changes in the bill were harder and really reflect real areas of compromise. And I think the biggest one there was new chemicals. The chemical industry made a very forceful case that requiring chemicals to have a full-blown safety determination before they get on the market would delay the entry of new chemicals to the market to such a degree that they would lose major business opportunities to chemical makers in China and in the Middle East, basically, where their costs are lower because of labor costs in the case of China, or because of access to the feedstocks in the case of the Middle East, and that in the American chemical industry only can compete with those folks on the basis of innovation, and that putting a year or two in front of when an American chemical company could register a chemical would basically make them lose those opportunities. So that was a very difficult, this is probably the most difficult issue in the whole debate, I think, for us, because it's just a basic clash of values that we would kind of feel like, well, even if that's true, we just shouldn't have chemicals on the market, that we haven't had a full-blown determination for. And there's a set of changes in the bill that I won't go into in any detail, but that basically left the current system of a 90-day window in place, had EPA making a judgment about whether what was available for this chemical suggested that it would pass the safety determination, the safety standard in the legislation. And then the agency, as it allowed the chemical on the market, sorting it for action after it's on the market, but immediately after, sorting it for the kinds of tracks that we described earlier, that if it's a chemical that is toxic, but they're making a claim that, well, we have a very particular use for it that is vital, and we're not going to use it for anything else, and here's why this use, maybe it's a defense, a fighter jet, something like that, one of these critical uses that they would describe, or a life-saving medical device or something like that. They can make that case, and then it goes into this sort of, you can use it only with all of these restrictions put right on it, and it's sorted that way right off the bat. Or, well, here's a chemical that we want on the market, but look, its hazard profile is so low that can it go onto the list of things that are basically set aside? It's like citric acid, it's like whatever. Or here's a chemical where, frankly, we don't quite have enough data. It's going to be used in some consumer things, and then it would get put on the list for a safety determination within the next couple of years, that it would get the full-blown treatment. So a massive improvement over the current system, but definitely a weakening of the principle that we went into this with, which was no chemicals getting on the market unless you basically have everything completely figured out and buttoned down. So that's one of the major changes that's there. The third area was confidential business information, and this is also a very, very difficult area, because you have a lot of companies, and I think particularly the chemical formulated companies like Procter & Gamble and others, SC Johnson, people whose make formulated products, and a key part of their business is that they might invent a new chemical for use in their products, and they put a lot of R&D into it. And they don't, if we make them disclose the identity of that chemical when they're filing it, that you're basically giving the technology to their competitors, either in this country or in other countries. And that takes away the economic incentive to innovate. And this is a very strongly held position there, and it really clashes with our value of right to know. And we changed the confidential business information provisions, again, in a way that require substantially more information to be made public than currently, that flip the burden onto industry from the government to industry has to justify confidentiality claims rather than the government having to justify making something open. So it's a major, major shift from current policy, but it basically allows them to make the case, whereas the original bill didn't, that chemical identity information in some contexts could be kept confidential, even if all these other things are, even if it's available to the EPA, it's kept confidential from the public to address this concern. That was basically the major change that was made in the version of the bill that passed committee. So there's more detail and nuance to that, so I don't want to bog down with a lot of time, but we think that those changes that were made to the bill show real good faith on the part of the Senator Lautenberg and ourselves in addressing the real concerns and legitimate concerns that people in industry have. They were necessary to get the votes of the more centrist Democrats like Max Baucus of Montana and Tom Carper of Delaware, where DuPont is a big player, and probably necessary to, as the basis for what is Senator Lautenberg's continuing outreach to Republican members to say, hey, I heard things, I listened, and I'm trying to, and you know, I want to work with you to have this bill accommodate reasonable, constructive concerns of industry. The problem we face politically is that the Chemical Industry Association, whose survival is sort of dependent on the idea that they can keep the whole industry in line on one set of ideas, has really fought hard to hide the fact that all of these changes have taken place from their members and from Republicans in the Senate as a way of preventing people from sort of recognizing all of them. And that has been a challenge for us, and Richard has done a blog to outline all of that. But basically, I'll stop there.
Okay. Thank you, Andy. I do want to be sure we have a little bit of time for discussion, but thank you so much for that update. And finally, I'd like to invite Pam Miller, founder and director of Alaska Community Action on Toxics, to say a few words about how ACAT is working in support of the bill. And then let's just plan on going over about 5 minutes for those who can stay for our discussion, if that works for our presenters. So go ahead, Pam. Unmute your line with the *2.
Okay, good morning, everyone. Can you hear me?
Yes.
Thanks, Diana, and thank you to Andy, Maureen, and Richard for sharing your great expertise with us. I'd also like to thank my colleagues here who are all gathered around the table, who have worked so hard on gaining support here in Alaska for the Safe Chemicals Act, and especially Samantha Englishew, our policy coordinator. And I just want to say ACAT is a founding organization, and we're really proud to be an organization that's a member of the steering committee of the Safer Chemicals and Healthy Families Coalition. And we aim to raise understanding about the particular vulnerabilities of the indigenous peoples of the Arctic. And we believe that ACAT does play a critical role in raising public awareness and informing Congress about the need for federal chemicals policy reform. This federal legislation, the Safe Chemicals Act, is of particular concern to Alaskans because persistent bioaccumulative and toxic chemicals are transported to the north via wind and ocean currents, sometimes hundreds and thousands of miles from where they're produced and used. The north has become a hemispheric sink for these persistent and bioaccumulative chemicals. They then accumulate in the bodies of wildlife and people who live in the north and the circumpolar Arctic. We are especially vulnerable to the health effects associated with exposure to these chemicals in our homes and through consumption of traditional foods. And we know now that indigenous peoples of the North have some of the highest levels of these persistent bioaccumulative chemicals of any population on Earth, despite being distant from places of manufacturing and use. We know that legacy chemicals such as PCBs and DDT are still accumulating in the Arctic. Levels of current use chemicals, some of the chemicals that Richard was speaking about that are found in everyday products, such as brominated flame retardants, are doubling every 5 to 7 years in certain Arctic wildlife species. Women of childbearing age in the Yukon-Kuskokwim Delta region of Alaska have some of the highest levels of brominated flame retardants in the circumpolar Arctic. So as Maureen said, this is not an abstract issue. This is a real and a very serious public health concern to the people of Alaska. A stronger national chemicals policy will help to reduce the production and release of these persistent and bioaccumulative chemicals that are carried to the Arctic through wind and ocean currents. Many of these chemicals, as Richard and Maureen spoke of, are associated with chronic diseases, including childhood cancer and learning and developmental disabilities, and these are on the rise. Some of the particular concerns in Alaska, because of their persistence, these chemicals are more likely to accumulate in northern environments and people. They're associated with immune system suppression, neurodevelopmental and reproductive harm. Here are some of our specific concerns about health issues in Alaska that could be related, or at least in part, to contaminants. Alaskan infants have the highest rate of birth defects in the country, especially Alaska Native infants. This high rate cannot be explained by risk factors such as tobacco and alcohol. Alaska Native infants also have a much higher rate of hospitalization for infections than any other group of U.S. infants. Prenatal exposure to contaminants, which are known to affect the developing immune system, could play a role, and that possibility is now being examined. In our work throughout Alaska, we hear of concerns about thyroid disease, reproductive problems, diabetes, and cancers. Although we do not yet know the extent that the rise of these illnesses is associated with exposure to persistent and bioaccumulative chemicals, it makes sense to take precautionary measures to reduce and eliminate these exposures. And we think that reform of the Toxic Substances Control Act is necessary as a protective and preventative measure. In 2011, ACAT prompted the Alaska Federation of Natives, the largest representative annual gathering in the U.S., 5,000 Native people, to pass a resolution calling for state and federal chemicals policy reform. This resolution is entitled Action for Protecting the Health of Present and Future Generations by Preventing Toxic Exposures Through Chemicals Policy Reform. This resolution advanced our state and federal policy work in 2012. In November 2011, Senator Mark Begich officially signed on as a co-sponsor of the Safe Chemicals Act. ACAT has been working to gain support and co-sponsorship of the Safe Chemicals Act from both of our senators, and we urge Senator Murkowski to also join as a co-sponsor, and for everyone on the phone to contact her office to urge her support of this. We know that as a Republican, Senator Murkowski is key to gaining bipartisan support, and Democratic Senator Begich is very influential among Democrats. In July of this year, Senator Murkowski was one of 3 Republicans, and we're very proud that she did this, among 26 senators to sign a bipartisan letter to the U.S. EPA administrator about the need to regulate toxic flame retardants, which is an important step toward supporting broader federal chemicals policy reform. This is a public health bill, especially one to protect vulnerable populations, and we have been working to encourage Alaskans to get in touch with our congressional delegation. On the ACAT website, akaction.org, there is more information about the Safe Chemicals Act and fact sheets on chemicals of concern here in the North. So we urge everyone to engage on this. Please contact Senator Murkowski. We need bipartisan support for this bill, and we thank you for listening today.
Thank you, Pam, and I'd like to ask our speakers to unmute themselves, and I would just like to ask if you have an extra 5 minutes and you could stay on the line. Richard, will that work for you?
Yes, that's fine, Diana.
Andy?
Yeah.
Okay, and Maureen?
Yes, thanks.
Okay, we don't often go over, but we don't often have so many incredible speakers on one call. So I would like to give a little time to discussion. Now, if any participant would like to ask a question, you may press *2 on your telephone to unmute your line. Please state your name and affiliation, and since we are so pressed for time, if you could please be brief with your comments. Thank you so much.
This is Diane Barton with National Tribal Tactics Council. I just wanted to ask you if you knew why Deputy Administrator Jim Jones, in his testimony to the Environmental Defense or whatever, that Senate committee, said that he could not, or he did not specifically say when he was being questioned by Senator Crapo that he could support this bill. They have a list, EPA has listed their essential principles for reform of chemicals management legislation. You're probably familiar with that website. And I'm just wondering if you have made any attempts to try to get EPA to come out and say they support this. I felt it was a very weak answer on the part of EPA when they were being questioned, and I wonder if that had anything to do with getting Senator Crapo not to vote for it in committee.
This is Richard. I'll take a stab at that. It's a very important observation, and it reflects, unfortunately, the tying of the hands of EPA in the current administration, where their role has been limited by the White House to one of providing technical assistance to congressional members and staff, rather than be able to actually endorse legislation or help to craft it. It's a source of frustration for many of us, including, I think, Assistant Administrator Jones, who I think does see many positive aspects to the increased authority and the other types of tools that the Safe Chemicals Act would provide. We've been trying to get the administration to at least allow EPA to play a more active role in this. It's tricky with the politics in Washington these days, and certainly there's some risk that the more this is associated with the White House and Obama, the more it might be seen as a partisan fight, although it's unfortunately becoming one anyway. So hopefully that dynamic might change after November, depending on what happens with the elections, but it's definitely a frustration.
The other part of your question, I don't think it played into Crapo's thing at all.
Oh, he was just against it.
Yeah, he was not. I mean, we actually spent a lot of time engaging that office, and the reason the Republicans, I think he was the person most likely on the committee to decide to play a role. And partly because of that, the American Chemistry Council reached out to Senator Vitter and got him to assert himself as sort of the lead on this issue because of its importance to Louisiana. And that led to a reshuffling on the Republican side where they basically agreed to follow Senator Vitter's lead, which basically meant not really caring what changes were made or not wanting to get into the details and just, opposing that bill. With the hope, I think, that next year they could be in charge and do something, more to their liking, if at all. So I think, unfortunately, for me, it's one of the biggest disappointments politically because there's actually a lot of support for this in Idaho, and I think that he personally was someone who cares about this. But I think that the fix was in before that, and that question was just because they basically know EPA, as Senator Lautenberg, I think, said in the hearing. If they had said, oh, yeah, we do support it, they would have been jumping all over that saying, see, it's a power grab by EPA. So I don't think the answer played a role in not getting his support.
Thanks for helping me understand that and the politics.
Okay. If there are no other questions, I will go ahead and begin closing out the call. If you do have a question that we didn't get to, you can email me at diana@acaction.org, and I'll be sure to direct your call to whichever speaker might be the best to answer it. So thank you again to all of you for joining us today. I'd like to remind everyone that a recording of today's call will be available on our website probably by Friday, if not sooner. And our next call will be on Wednesday, September 26th. It will be on preventing harm to children, the Healthy Schools Movement, with guest presenter Claire Barnett, who is founder and co-director of Healthy Schools Network, Incorporated. Please visit our website at acaction.org to sign up for the call, or you can call 907-222-7714 for further information. Again, I would like to thank all of you for joining us today, and I'd like to thank our speakers once again for your time, your expertise, and thank you so much, and have a wonderful day.
Thanks, everybody.
Thank you.
Thank you.